So let me go to my first guest tonight. My newsmaker tonight is Kerala's Health Minister Veena George, television anchor turned politician. Appreciate your joining us, Veena. The question that everyone is asking, what has gone wrong with your Kerala strategy? Your critics are saying that here was a state that everyone was lauding a few months ago, but now you have the maximum number of cases in the country. More than 50% of the new COVID cases today came from Kerala. You are the COVID hotspot. 3 consecutive days of more than 22,000 cases. Has something gone wrong with your model or your strategy, Veena George?
The second wave started in Kerala by the middle of April, and we had our maximum number of cases on May 12th. On May 12th, we had more than 43,500 cases. And then the number of cases went on decreasing, and then we entered a plateau. And still we are going through that plateau, although we have an ascending trend in our state. Our TPR is almost around 10%, 11% or 12%.
No, ma'am. Let's look at it this way. You are saying that you use the word plateau, that Kerala has plateaued the wave. You didn't have the high spikes that other parts of the country witnessed. But the fact is, ma'am, the rest of the country now has sharply declined from the highs of the second wave in April and May. Kerala may have plateaued, but in the last 10-15 days, once again, we are seeing a rise to more than 20,000 cases in a day, while the rest of the country, many parts are in single and double digits. You are saying the test positivity ratio is between 10 to 13%, but that's again high. The rest of the country is declining. Kerala continues to register strong numbers. Does that worry you or not, ma'am?
See, during the second phase of the wave, the disease is getting spread due to the Delta virus. And as you know, in Kerala, we do the maximum number of tests. Yesterday, we did more than 1,96,000 tests, and today we did more than 1,63,000 tests. And we are doing targeted tests because if we find one person positive, what we do is that we test all the persons around him, in his contacts, all the primary contacts, the secondary contacts, and the tertiary contacts. So the chances are very high that all the persons that we test, or in all the persons we do the test, there are chances that they will be positive. So the TPR, the test positivity rate will be very high.
So you're saying Kerala is doing targeted testing, and because of the targeting testing, the numbers are high. But then other states are also testing now, ma'am, fairly large numbers of similar size population, Assam being an example, for example. But we are not seeing the same test positivity ratio in those states or the same caseload as Kerala at the moment. Now, I want to understand why. That's why we want to do this. The seroprevalence survey, ma'am, of ICMR shows that only about 42% of Kerala's population has got antibodies compared to the 67% in the rest of the country. This suggests that you have a large vulnerable population out there at the moment.
Yes, the number of tests is very high when we compare the total population of the state. We have 3.5 crores of people in the state, and the tests we done per million, when you compare it with the other parts of the state, it's very high. So the test per million is very high in Kerala, and also the vaccination per million we do is also very high. As you said, the ICMR study, the seroprevalence study, shows that only around 42% of the total population in Kerala is so far infected or have developed antibodies in their body, and it can be either through vaccination or because they are infected by the virus. So it means that more than 50% of the total population is still vulnerable and susceptible to the virus. So it shows that our preventive mechanism was very good, that we were able to, or we were successful in protecting our people from the virus. So the only way before us is to vaccinate our people, and we are doing the vaccination in the best way possible. Also, we have a very good system, and the vaccination, if you check the COVID portal of the central government, the vaccination per million, the first position is ours. So the next is Gujarat, and it goes on like that. So the first position in the vaccination per million rate is also, it's Kerala.
Ma'am, you know, you are the first position in vaccine. You are actually the second. May I correct you? You are the second per million after Himachal. Then there is Gujarat when it comes to vaccination. But while you are vaccinating a large number of citizens, you are also adding a large case load. You know, the fact is, many believe you were successful in the first wave in your containment strategies, but maybe Kerala let its guard down in the second wave. It started with the elections in Kerala in March, April. Then there were pressures on your government to open up shops. You did alternate days opening up of shops, but now we are seeing Bakri Eid relaxations a few days ago were allowed. Your critics are saying that the Kerala government, especially during the Bakri Eid, should not have allowed the relaxations in this ad hoc manner for 3 days. Either you allow complete relaxation if you believe the situation is under control, but you can't allow it for 3 days for a religious festival. Did you let your guard down, ma'am, in the last few months in the second wave? Did you get overconfident?
This was the case during the first wave too. You may be remembering, because in January 2021, we contributed the maximum number of cases in India, and I remember almost 50% of the cases in the country was from Kerala during January 2021 too. Why? Because we have always tried to drag the wave. We have always tried to keep the number of patients or the number of positive cases below the max medical capacity threshold. In Kerala, there was never a case where there is a patient who died without getting oxygen or without getting hospital bed or without getting ICU facility. So we always try to we ensure that all our people, those who are infected, all the positive cases, they do get hospital aid and they do get oxygen support, or if they need ICU support, we ensure that they are also getting ICU support. And in this phase, if you go through the data, you can see that the hospital occupancy is very less. And as I told you, the test per million in Kerala is very high. When you compare the total population, we only have around 3 crore 51 lakh people in our state. But when you compare the tests done with the total population, it's very high. Also, we are doing targeted tests, and also it is because of the Delta virus. Yeah.
No, ma'am. I am not disagreeing with the achievements of Kerala. I'm not trying to minimize your achievements. But the fact is, I asked you about letting your guard down, especially during Bakri Eid. The relaxations for which even the Supreme Court has pulled up the Kerala government warned that you should not have done it. Do you believe in hindsight that some of those were mistakes, like Bakri Eid relaxations, that some of those districts now where numbers have gone up like Malappuram is a worry? Could that be because of relaxation and allowing this overcrowding during these 3 days? Are you under various pressures? Merchants and traders want you to open up, religious groups want you to open up, and the Kerala government is in a bit of a bind.
Sir, during those days also we had TPR was around 10, 11, 12 like that. And here we have a coordinated effort, all the coordinated activities of all the departments, the police department, the LSGD, the health, and also the people are cooperating very much to control the disease. And I'm so sorry to say that it's quite unfortunate that there is a campaign against the state saying that the system has failed and all. But when you see the virologists, the experts, when they say that Kerala is a system in Kerala is very good still now. Why? Because the density of population in Kerala is very high, and it is double the national average. So here we have more than 860 people in 1 square kilometer.
Ma'am, density of population is also there in Mumbai, but cases are coming down. Let's not, I mean, my point is, ma'am, you seem to have no regrets at the moment for allowing any lifting of restrictions. I'm just trying to understand that questions will be raised. Onam is coming. Will you allow similar restrictions and will you allow similar opening up? Will that lead to another spike? It appears that while you tell me on this show that you have the situation under control, the fact is your government has just today announced a further clampdown, a lockdown on 30th, 31st. Does that suggest that are you worried in a way that you're now going to have a strict 2-day lockdown over the weekend?
So we cannot keep the people for in a lockdown, or we cannot keep the people in their house, shutting their their shops or their institutions and all. So the government of Kerala is vigilant in this part of the in this phase of the second wave, and these 2-3 weeks are very crucial, and we are closely monitoring the situation.
No, but the very fact that you've decided to enforce this strict weekly lockdown, does that mean in a way that you've realized that while you need to open up and ensure that livelihoods are not lost, at the same time the worry of these 20,000 plus figures for the last few days means that you can't lower your guard and fully open up? Kerala is caught in a bit of a bind.
So we have weekend lockdowns. We have lockdowns on Saturday and Sunday, and we are asking our people to remain in their houses during Saturday and Sunday. This is a collective decision. It's a collective decision of the state, and it's a decision of the review committee chaired by the Honorable CM, and all the departments are there in that committee, and the health department will give all the data, and the committee will review the situation in the state. And we have categorized all our LSGDs, all the panchayat, municipalities, corporations according to TPR. So from 0 to 5% TPR, if we give relaxation, and from there will be more relaxations in the group from 5 to 10, and from 10 to 15 there will be more relaxations, and it will be like that. And there will be triple lockdown in those LSDDs where the TPR is more than 15%. Why the TPR is high? Because we are doing targeted tests.
Ma'am, you keep saying you are doing targeting testing and therefore the TPR is high. I'm willing to concede that. But let me ask you then, if you are so confident, A, will you then start opening up? Will you, as I said earlier, open up for Onam? Will you allow that to take place, your biggest festival, with greater, allow it to be fully open? Because in a way, otherwise, you're going to become a victim of your own success. That you enforced a strict lockdown, especially during the first wave, has meant that your sero prevalence is less than many other parts of the country. People in Kerala don't have the same antibodies that they have in other parts. So I ask you, has the time come, perhaps starting with Onam, for actually Kerala to open up, allow people to go outdoors? That's the other way to look at it.
We are doing review meetings every alternate days. So tomorrow also we have a review meeting. So we are analyzing the situation, and we are analyzing all aspects of the situation, and we will be taking decisions accordingly.
You're being very, very diplomatic there, ma'am. There is one more charge against your government, and that you are fixing COVID data. The opposition has said that there are about 7,000 cases that are being undercounted. The leader of the opposition, V.D. Satishan, says he claimed he got that data through an RTI. The total toll, he says, is 23,486, not 16,170. Are you also guilty, ma'am, of undercounting?
We are doing excess death analysis, and we have, or the government has already declared our position. If there is any complaint or if anyone is left out, we'll definitely include that, because when you go through the excess death analysis data of different states in our country, you can see that the excess death analysis show that even if there are underreported deaths in our state, the number will be very less when you compare it with other parts of the state. Even then, the death rate will be less than, it will be somewhere around 0.8, or it will be definitely less than 1%. So which shows that the death rate in Kerala is, again, and even if there is anything like that, then also the death rate in Kerala will be the lowest in the country.
Ma'am, the fact is your case fatality ratio in this second wave has gone up from about 4.4 to 0.56%. Clearly more people have died in Kerala in the second wave, and God forbid, the worry is that this second wave, if you allow it to prolong further and you're not able to bring down the numbers, could well be carried into a third wave, and Kerala in a way could become a springboard for other parts of the country. That's the worry.
We are now doing online real-time entry of the deaths, and we are doing it from the hospitals, from the institutions itself. The doctors can register the death online, and the declaration will be done at the district level. So we make sure that all the deaths are being reported, And soon after the new government sought in, we formed a new software, or we created a new software, and from June 16th onwards, through government order, we have asked all the institutions, all the hospitals to do the real-time entry of the deaths to make sure that no COVID death is underreported or it's not reported.
Are you not worried, Veena George, that the longer these numbers remain in the 20-25,000 range, the more worrying it gets? I mean, the more you try to prolong the wave, in a way, you could get caught up with new variants emerging. Do you really believe that the worst is over, that people are exaggerating what's happening in Kerala?
See, what we find is that at this part of the second phase, second wave, we have more breakthrough infections. Because the less hospital occupancy, the less ICU occupancy, or the less demand for oxygen, it shows that we have breakthrough infections, more breakthrough infections, because the infections are more in those people who are already vaccinated. So the severity of the disease is very less. If that is the case, we are trying our best to decrease the number of cases, and we are increasing the tests, and also we are making sure that every single case is being reported. And also in that case also, the study showed.
Ma'am, you're trying to give I understand where you're coming from in a way, because Kerala has a reputation to protect. But despite the high level of vaccinations, for example, there is a case rise. I mean, that to my mind, as I said, you seem to be becoming a victim of your own success. A large proportion of your population is vulnerable. As the Sero survey showed, you may have high vaccinations, but you're getting a high caseload. Why not accept that now and then find solutions for containment?
Yeah, because that's what I was trying to explain now, because we have more breakthrough infections now. And we are trying to give more vaccines to the people, and we are requesting the central government to give us more vaccine, and we are asking the central government to give vaccine on the analyzing the percentage of the vulnerable or the susceptible population left. So I think that's the highest in the country. So we are requesting for more vaccines.
Are you telling me today that you're not getting enough vaccines from the center, that you can vaccinate far more people?
We are looking forward. They are giving us vaccine, and yesterday we got more than 9 lakh doses of vaccine. So we'll be vaccinating, and that the people with these doses of vaccine, today we did almost 2.5 lakh vaccinations, and tomorrow also we'll be doing that. So in 3 days we'll be.
Ma'am, listening to you, it appears that you seem to be fully in control. If the situation was so much in control, why is the centre sending a COVID management team to Kerala? Clearly the centre believes the situation is not under control.
We are welcoming them, sir, because I think this is the second team from the central government visiting Kerala in a couple of weeks, and the last team, I had a discussion with them, and they told us that they are very much satisfied with the way we manage the pandemic, and they are not at all worried about the TPR, because this is expected in this second phase, because the Kerala, as we know, we have more vulnerable, susceptible population. So this is expected. They said the communication was like that. Yes.
My final question, ma'am. Today, when I see my Twitter timeline, I'm seeing lots of people, many of them associated possibly with the BJP in particular, saying that, look at Kerala. You all were screaming hoarse about UP. But look at what's happening now in Kerala. When people from, let's say, Uttar Pradesh, Bihar, Delhi will look at the figures and say, just because of Kerala, India's case numbers are looking high, we will get a third wave in the country because of Kerala. Kerala has failed. Kerala's model is based on PR. What will you tell all those people?
With the second wave was started by the mid of April. And the Delta, the virus, here we have the Delta variant in the second wave. And the chances in Kerala is very high that the disease will get spread easily. We are trying to control it, And the only thing we have to say is that everything is under control, and we are trying our best. The government is trying our best to protect our people from the virus, and the people are really coordinating to all the measures adopted by the government.
You know, in a way, ma'am, you've given us, at least for the first time in weeks, months possibly, an explanation as to what is happening in Kerala from your perspective, and for that we've been chasing you up for the last few weeks. I appreciate your joining us. Your predecessor Shailaja, teacher, became rather famous, and you as a TV anchor turned politician, I wish you well. You have a tough task ahead of you. Thank you very much, Veena George, for joining me. Thank you.